Well, when it comes to deliberate release of chemicals, I think many countries in the world now consider that that's a risk or a threat. There are two categories of chemicals that might be used. There are chemical weapons, things like nerve agents, mustard agents, and those are not widely available. Some countries still have stores of those chemicals. Some terrorist groups may have expertise to develop those chemicals, but we're talking about really quite limited availability, and so the likelihood that those chemicals will be used is high in certain parts of the world and probably almost negligible in other parts of the world, I think. But we know, for instance, that in Syria, nerve agent was used because that was confirmed by OPCW investigation. So that's the chemical weapons. And then there are the toxic industrial chemicals, of which there are many, many. And those can also be released deliberately. And a very common chemical would be chlorine, because it's taken around the country in big tankers. It's used for water treatment, so it's a very easily available chemical, and it's a chemical that's, it's relatively easy to hijack a tanker and then shoot a few holes in it, and the chlorine gets released, and that's happened. I guess the chlorine release is pretty obvious because you can smell chlorine, and the effects are very well recognised. I guess there's always the risk that it could be another chemical which was less well known, less obvious, and the first sign is that people start to become ill, and then you're wondering, well, what could this chemical be? That takes us back to the Angola situation in a way, that there are hundreds and hundreds of chemicals, and yes, it can be quite difficult to identify just from signs and symptoms alone. If a country has a poison centre, then they should be going there and asking for the assistance of the toxicologists at the poison centre. There are also various databases on the internet that have information on chemicals, including the INCHEM database.
Yeah, before I talk about the INCHEM database, because we are talking here really about human health risk assessment of chemicals, we have a kind of flagship document, which is the WHO Human Health Risk Assessment Toolkit for chemicals. That leads the user through the full chemical risk assessment process, and can be used also for rapid risk assessments in emergency situations. This toolkit or document is available on the internet, on the WHO website, and from there we have about 100 links to resources. We have information about how chemicals are classified, whether they are toxic, moderately toxic, or less toxic, for example. We have information about the type of toxicological effects, but how to do exposure assessment, how to characterize the risks. And reference values are very important. So if we know that a soil, or let's say drinking water, is contaminated, we ask the question, is there a risk to the population who are consuming these waters? So this is a typical risk assessment question. And if we want to have a reference value below that, could be this reference could be found also through that toolkit. We have, of course, other databases like the INCHEM database mentioned by Joanna before, which is much broader. In international chemical safety data sheets, which are also very interesting in a chemical emergency context, because they give you information about chemicals in a very concise way. It's only one sheet, but it is very informative, and you can digest this information within a couple of minutes. It's very helpful in an acute emergency context.
And they're multilingual.
It's multilingual, not only UN languages, but many other languages. So, but we have also other databases. We have produced something where all international organizations who have chemical safety activities. As I mentioned before, it's a multi-sectoral issues. And so we have 10 international players who are having chemical safety programs, and they're bringing their documents all into one place. IOMC, Inter-Organizational Program for the Sound Management of Chemicals. These are the 9 to 10 international organizations which coordinate their chemical safety work, among them WHO. And they have one website where they bring all their documents together. And there is a special scheme on chemical accident prevention, prevention, and response. So it's not only the information which is of interest to the health sector, but it's all the information produced by all international organizations for their different target audiences dealing with chemical emergency issues.
Just coming back to chemical weapons, I should also mention that we do have some specific guidance on management of chemical weapons exposure and the syndromes caused by chemical weapons on our Environmental Emergencies website in English and Arabic. With the Eastern Mediterranean region, our Centre for Environmental Health Activities in Jordan also has information in English and Arabic.
In the case of Angola, the expertise we are mainly needed is really having a clinical toxicologist, especially if we talk about signs and symptoms, description of signs and symptoms, and turn them into an idea of what chemicals could have caused these signs and symptoms. And in Angola, we brought also an environmental expert in because we did some environmental surveys. So we went into the communities, we looked there what kind of chemicals are being used in agriculture. We even looked at illegal drugs and this kind of things. Another expertise we need are then environmental epidemiologists. So in the case of Angola, we brought that in through our Afro office. But the interesting part of chemical emergencies is that it's the expertise which is needed is not necessarily in the Ministry of Health. So even if you go in a country and the expertise is there, you expect the expertise to be there. It's not always the case that you find them with the Ministry of Health. Maybe a clinical toxicologist, maybe poison centers, which are linked to the ministries of health. But you might well find environmental laboratories within the Ministry of Environment, or maybe occupational health experts, which are with the Ministry of Labor. When you're dealing with pesticides, you might find the expertise in Ministry of Agriculture, but also some for civil protection, you might also find expertise there. So in the case of chemical emergencies, a rapid response team should search for expertise also beyond the Ministry of Health. Yeah, so in the chemical safety community, there is a good understanding of what is meant with risk assessment. In fact, terminology and methodology has been agreed upon over the last 20 years, and we have reached a stage where we talk a common language, and when we think about methodologies, we know what we mean. Risk assessment, for example, is defined by 4 stages. It's hazard identification stage, it's the hazard characterization stage, then there is the exposure assessment stage and the risk characterization stage. These are the 4 stages which try to answer different aspects of the risk assessment process, but all together they are considered to be the risk assessment methodology. A rapid risk assessment team, which is in the field, is confronted with an uncontrolled release of a chemical, for example. Then this team should be aware that chemical expertise is not only available in the Ministry of Health, for example, in Poison Center, but also is available in other ministries. Ministry of Environment, laboratories, for example. Exposure assessment expertise is often available there as well. We have expertise often in the Ministry of Agriculture dealing with pesticides, fertilizers, when it's about these substances. Toxicological expertise is sometimes available in the Ministry of Labor in the context of occupational health, which can be hosted in that. So it's very important to think beyond the Ministry of Health.
If you are in a team in the field and you're planning an investigation into an outbreak that you think is caused by a chemical, I would advise at a very early stage to get advice, toxicological advice about sample collection. Either you can ask a toxicologist if you have one in the country, or you can direct an inquiry to WHO. But that's important because the time frame, if you're talking about biological samples, the time frame for having a sample in which there will be chemical present is relatively small. And so you have to get your samples quickly, but you have to get the right samples, because there are some types of chemicals that are better analysed in urine, some that are better analysed in whole blood, some that are better analysed in serum. Sometimes the material of the container can make a difference. If you're looking at organic solvents, for instance, they can migrate through a plastic container. So, and you may only have one opportunity to collect those samples. So it's important to get the advice first before you start collecting the samples, so that you don't waste resources and you don't waste people's time.
Yeah, finally, there is quite some information of chemicals outside in the world. And I'd like to raise the awareness about especially the information provided by the international organizations. You can imagine that each country, especially in the Western world, has its own databases. But I recommend to the international rapid assessment teams really to refer to international databases, which I'd like to mention the WHO toolkit for the human health risk assessment of chemicals. There's the database, the INCHEM database, which also the chemical team can be approached preferably through the country and regional offices. And then we can mobilize our networks as well. So